I am Dr. J. Akef. I'm a certified periodontist. I also specialize in dental implants. In this session, we're going to talk about recession coverage with pinhole surgical technique. There are three different ways that we can cover recessions on the root surfaces. Let me show it to you on this model. You see, you have the healthy gum here and receded gum here. So what it happens is that when you have healthy gum here, you have your bone right at this level, a little bit off of the crown portion of the tooth. On this one here, you see you have quite a bit of recessions here, and the bone is way further down. Now this is an advanced case. This is rather small to moderate case here, small to moderate. So what happens is that we can go ahead and try to correct this situation here by taking a piece from the roof of the mouth and preparing the root surface here and the gum here by removing the top layer of the gum, and we take that piece that we took from the roof of the mouth and graft it here, and then suture it here and wait for it to heal up. Now the roof of the mouth in that scenario becomes kind of sore. It's like a big pizza burn. Now nowadays what I do, I go to the very last tooth and I take the tissue from there if possible, and that makes it not as sore at all, and patients don't even know about it. However, in this method, it's very difficult to bring the gum all the way to where it should be. This is called a free gingival graft. Now, the other technique is that we numb you up again, we make little incisions here, we undermine this and release this tissue here and literally pull this gum up to this level. That's called coronally positioning flap, and that's done as well. And when I do it, I put a membrane over it to generate this bone to come up from down here to come up to cover the receded parts. The other method, which is rather non-invasive, is called pinhole surgical technique. We put a hole the size of this one here, or this one, on both sides here, and we open this area here by just undermining this tissue and do a tunnel procedure and lift up the gum from the bottom up, and this whole thing is going to lift up here, not over here, not over here. It's just going to lift up. So it's no incision involved, most of the time no suturing involved. That way we can put membrane through these holes and cover these receded parts. Most of the time, patients that go through this don't really have much of an issue. They can go back to their normal routine, daily life the next day. Now, let me show it to you on a person that we've done on a slide here. You see here, there was recession here, and here, and here. So we did what we did. We put a hole right there. We put a hole right there, and lift up this gum around these teeth without making any incisions, and that's the key. Now the patient swells up a little bit on the lip the next day, and that's about it. And after that, they're pretty normal. They don't even know what we did the next day. And then the tissue is moved further down. You see the end result here. And the bone, because we put membranes here, the bone kind of moves down with it to give it more support. And the result is really good. One of the best things about it is that the color of the tissue is the same. We are not taking it from the roof of the mouth and grafting it here. Therefore, we don't have a different color here or here when we do it with the other methods. Sometimes we get that result and it's not good. Now, these were three different ways of recession coverage, the last one being pinhole surgical technique. If you have any questions, please contact me through SanDiegoDentalImplants.com. And thank you for watching.